Welcome back to the Pump YouTube channel. As a part of our Everything You Need to Know Before Med School series, we're honored to assist future medical professionals in gaining the insights they need when selecting programs and charting the optimal path for their medical careers. In this video, we're focusing on the University of British Columbia's MD program. UBC's Faculty of Medicine offers Canada's geographically largest program, distinguished by its innovative distributed learning model that spans the entire province of British Columbia. UBC's MD program emphasizes a patient-centered curriculum that integrates scientific inquiry with clinical practice. The University of British Columbia's MD program is delivered across 4 distinct sites. The Vancouver Fraser Medical Program, based at UBC's Vancouver campus, is the largest site, offering clinical education through discipline-based rotations at various hospitals. The Southern Medical Program, located at UBC Okanagan in Kelowna, provides learners with clinical training experiences in numerous communities throughout the interior health region. The Island Medical Program, situated at the University of Victoria, allows students to gain clinical experiences across the capital of British Columbia and Vancouver Island. The Northern Medical Program, hosted by the University of Northern British Columbia in Prince George, focuses on training physicians from and for northern and rural communities. Now that you have a better picture of the University of British Columbia and its MD program, let's dive deeper into their admission stats. With 2,815 applicants, UBC accepted 10.9% of them, or 306 students in 2022 to 2023, which is still an increase from the previous 2 cycles, both accepting 288 students. UBC has a preference for in-province students. Of the 306 accepted students, 90.2% were in-province, while the other 9.8 were out of province. Among the 2023 first-year MD students, about 27.8% of students have a postgraduate degree, 20.9% have a non-degree and 3-year bachelor's, and approximately 51.3% of students have a 4-year bachelor's. Numbers aside, someone's getting in. Why not you? Let's dive into what it takes to make that 10.9%. At the University of British Columbia, you cannot enter the MD program straight out of high school. You must complete at least 90 university transferable credits from a recognized post-secondary institution by April 30th of the year of entry. It is also important to note that UBC isn't admitting international students. You can apply as early as your 3rd or 4th year of undergraduate studies, depending on how quickly you complete the required coursework. Like most medical schools, you'll need to show proficiency in biology, chemistry, and biochemistry. Unlike most medical schools though, UBC also requires 6 English credits, specifically 2 literature classes, or 1 literature class and 1 composition class. Academically, your GPA plays a huge role. UBC factors in grades on the 100 scale, based on your numerical grades and not your letter grades. While the minimum GPA for eligibility is 70%, competitive applicants generally have a much higher score. If you're a BC resident and you have an overall GPA below 75%, or an out-of-province applicant with an OGPA below 85%, your application will not move forward to full file review. Basically, UBC won't even consider your non-academic components if you don't meet those GPA thresholds, so it's key to keep them up. For reference, the average OGPA for accepted applicants in the 2023 cycle was 89.63%. Moving on to the MCAT. UBC requires a minimum score of 496 to be eligible. That being said, the average score for accepted applicants was 514 in the 2023 cycle, and there are no minimum subsection scores. Moving on to non-academic requirements, UBC puts strong emphasis on personal qualities like leadership, communication skills, community involvement, and commitment to the field of medicine, which is assessed through your non-academic qualities section. This section has significant weight as UBC wants their future students to be as diverse as the communities they'll end up serving. Your NAQ score is based on 5 categories: leadership, service ethic, capacity to work with others, diversity of experience, and high performance in an area of human endeavor. Evaluators especially like to see applicants who have higher responsibilities, along with long-standing commitments that reflect a genuine concern for others. Important to note that physician shadowing, although sounds great to have on application, doesn't affect your NAQ score. Your NAQ is determined based on a report of non-academic experiences, employment history, research, awards, and if you're invited for one, your interview. Although all these requirements may seem overwhelming, it's important to not let that discourage you. The last step of the UBC MD admissions process is the interview stage. UBC typically invites a select number of applicants to participate in interviews based on the strength of their academic and non-academic files. In the 2023 cycle, 13.1% of applicants were given an interview. Interview invitations and rejection notices are sent out on a rolling basis until the final interview date. For the 2024-2025 cycle, UBC uses the multiple mini interview or MMI format, which is done virtually through the Kira Talent platform. The MMI includes a series of timed interview stations designed to evaluate qualities like ethical reasoning, communication, empathy, and decision-making. There are about 11 different stations. Each station you're given 2 minutes to read the question and another 7 minutes to answer. When it comes to prepping for UBC's virtual MMI, it really helps to set up a quiet space where you can think clearly and feel comfortable speaking out loud. The MMI is fast-paced and designed to see how you think on the spot, so it's a good idea to get used to answering questions under time restraints. This isn't to say speak faster, it's more about how you get to your point across without rambling. Some students even suggest that during your answering period, it's okay to take a quick pause and collect your thoughts, as it shows self-awareness. Practice with common MMI scenarios, time yourself, and focus on being clear and honest in your responses. Think back to your own experiences, volunteering, work, or tough situations you've been through, and use those stories to your advantage. Really show the interviewer how you're able to communicate and connect with others. At the end of the day, the interview isn't about being perfect, because there is no perfect answer that the interviewer is looking for. Let's switch over to the cost of tuition now. Tuition fees can vary slightly year to year, but for the 2024-2025 cycle, tuition for domestic students is approximately $19,995 per year, plus $1,853 on textbooks across 4 years. Other than school expenses such as housing, food, transportation, and etc., those range from $17,000 to $20,000. Now that we've covered tuition, let's take a look at how UBC's MD program unfolds. It's crafted to shape physicians who embody the roles of medical expert, communicator, collaborator, leader, health advocate, scholar, and professional, aligned with the UBC MD exit competencies, preparing graduates to serve diverse communities across British Columbia. In the first 2 years, the Foundations of Medical Practice courses consist of MEDD 411, 412, in Year 1 and MEDD 421, 422 in Year 2. These early courses follow weekly clinical case presentations that integrate biomedical science, ethics, communication, labs, small group discussions, and a simulated and real clinical experience. Year 2 culminates in a transition into clinical education, aka TICE, a phase to help students prepare for clinical responsibilities in Year 3. During years 3 and 4, known as clerkship, you enter clinical environments aligned with the Vancouver, Fraser, Northern, Island, or Southern regional sites across the province. You rotate through core disciplines such as internal medicine, surgery, pediatrics, psychiatry, family medicine, and emergency, including rural and community placements, to ensure broad exposure to many forms of medicine. Wrapped into multiple phases of the curriculum is flexible enhanced learning, also known as FLEX. Starting in MEDD 419 in Year 1, continuing through MEDD 429 in Year 2, and culminating in MEDD 449 in Year 4, FLEX gives you a structured time to pursue scholarly projects, research, or community engagement, helping you build skills in innovation, self-directed learning, and critical thinking, which offers significant time in the curriculum for students to develop and explore their own identified learning projects and goals and objectives. Assessment at UBC's MD program is based on a percentage and a pass-fail system. Foundational and clerkship courses are graded accordingly using the percentage system, and flex assessments require passing each component independently. This should give you a clear, comprehensive overview of how UBC's MD program is structured, from foundational learning to clinical practice and scholarly exploration. For more details, check out their official website regarding their MD program. We hope this video gave you a clearer understanding of the University of British Columbia's MD program, from its unique campus model to its focus on community-centered healthcare and academic excellence. Having said that, the Pump team wishes you luck with the application process. Thank you for watching the video, and if it was helpful to you, please like, comment, and subscribe. We hope to see you in our future video.